Hello and welcome. We begin with the latest on Mpox outbreak in Africa. The continent is on the front line of the fight against the viral infection. The Africa Centers for Disease Control and Prevention says it is close to securing 1 million Mpox vaccine doses. Africa CDC estimated that the continent needs 10 million doses, with the Democratic Republic of Congo being the most in need. The African Union's health watchdog has also urged manufacturers to share the vaccine-making technology to battle the disease. Several countries have assured vaccines to African countries hit by outbreaks. Spain is the latest to pledge 500,000 doses. Germany will also be sending 100,000 doses to East Africa. Now, on Thursday, a first batch of Mpox jabs arrived on African soil amid the current outbreak. Nigeria received 10,000 doses of the vaccine from the United States. The country began the process to secure the vaccines well before it was declared a global health emergency by the World Health Organization last month. Nigeria has confirmed 40 Mpox cases this year, but says that the true number could be more than 700. The West African nation has not recorded any deaths from the virus. It has also not recorded any cases of the clade 1b, which is the new variant detected in the Democratic Republic of Congo that has spread to neighboring countries. The DRC has borne the brunt of the epidemic, with 90% of cases reported this year. Burundi, Rwanda, Kenya and Uganda have also been affected. Over 22,000 suspected Mpox cases and 622 deaths have been reported in Africa this year. The viral disease is transmitted from animals to humans and can also be passed from human to human, causing fever, muscle pain and skin lesions. Now, the World Health Organization says that more research is needed to understand how the outbreak is spreading. It said that droplets were a minor route of transmission compared to physical contact.
Mpox is evolving rapidly. The fact that clade 2b evolved over a period of 5 years to a new strain, and now we are having clade 1 evolving rapidly to a new strain. We are not too sure what new strain will emerge in future and the implication of such new strains.
The Africa CDC says the continent needs around $245 million for the Mpox response and for resources needed to mobilize. However, Africa has secured less than 10% of the estimated amount. The continent is increasingly under pressure to curb an outbreak of the deadly infection.
We are still working blindly in Africa. We don't have the required knowledge about Mpox, natural history, transmission dynamics, risk factors of Mpox, and essentially you need to understand your context. You need to understand your disease for you to develop or design preventive strategies against such a disease. And that's a significant limitation, and that tells us that we need to invest in uncovering, understanding our disease better.
There are still no Mpox-specific vaccines, but smallpox vaccines have worked against the infection. These vaccines, manufactured by two pharmaceutical companies, Denmark's Bavarian Nordic and Japan's KM Biologics. Critics say the process of getting vaccines to Africa has been slow, with the WHO's regulatory process posing a major challenge. You see, most of the African nations rely on the WHO to know which medication is safe and effective. But 2 years on since the last Mpox outbreak, the WHO has not officially approved the two vaccines. The global health body says it does not have the data that it requires to do a complete review. Now it has asked vaccine manufacturers to register their interest in receiving an emergency license for the Mpox vaccines. This would allow the World Health Organization to fast-track its approvals. Regulatory delays will only worsen the situation in Africa. Mpox cases are rapidly rising, with some countries reporting cases for the first time. Africa CDC says the infections had jumped 200% in the last week. Medical experts in Africa say the current outbreak is largely a result of years of neglect and the global community's inability to stop sporadic epidemics among a population with little immunity against the disease. Can the world come together to help Africa fight the outbreak? Now, for more, we have with us Michael Gitau, who's an emergency care specialist and infection prevention control expert. He joins us live from Nairobi, Kenya. Thank you for being with us.
Thank you for having me.
Now, how effective have the current public health measures and vaccination campaigns been in controlling the spread of Mpox? And what are the concerns surrounding the Mpox strain that seems to be mutating fast?
Thank you very much for the question. Just like any other emerging disease, and more so these outbreaks, some points they find us that we are not well prepared, and not only in Africa, even globally. So there's those key strategies that any government or any institution wants to put across or to have them ready. And some of the key strategies, one is for having the early detection, and this is detecting early by testing and also your diagnosis, because again, there is a very big misconception that these symptoms, because some patients are asymptomatic and others they could exhibit a few symptoms. So the early detection is key. That is one of the key strategies. And now meaning you also strategize where you increase the facilities for testing. Then should you get now a case that is now a suspected case. And also, if I give a reference with the Kenya, is that we have had more than 250 patient suspected cases. Now, these, remember, they have not already been confirmed. So that means it's from the entry point at the border post. So when they are picked from there, this is now where they are isolated, then there is a testing. After now we get to test these patients, if there's a confirmed case, now the next procedure is a contact tracing, because again, if we don't trace these who are already infected, that goes back to the community. And that means there's a transmissibility level increases. And as you increase, that means even there is going to be resistance. And more so, even where we're discussing now, we have inadequacy of vaccine. Then finally, then the other strategy is to have the post-exposure vaccines. And now this is where the elephant in the room is, because as you have mentioned previously, that we do not have enough vaccine yet. So this is a lot that has been requested, a lot of vaccines that's been requested, because if you look in population-wise in the whole of Africa, we are more than 1.5 billion. So we require a lot to vaccinate and overcome these. So those are some of the key strategies.
Absolutely,
that,
Michael.
Yes, I could talk of.
Yeah, we'll get back to the availability of vaccines. But first, what are the potential economic and social impacts of the Mpox outbreak on the affected regions? And what steps can be taken to mitigate the effects?
Okay, another good question. So I'll start off with the social impact. One of the social impact is the case of the public health strain, because now as medical facilities, or including the healthcare providers, perhaps we don't have proper trainings, and mostly the limited resources settings, that we perhaps now you're finding that the team that is already trained to avert or address these patients, then again it gets strained, because again we don't have many people who are trained. That will be the one. The other point is in a social impact is a social stigma. I've had some patients who get infected that they are getting isolated. because of just the presentation of the disease. It's really, really a big problem. And the other thing you're looking at with that isolation, there is a lot of mental health or the mental well-being for both healthcare providers or the community health providers, and including the patient themselves, so because of the isolation. The other effect we find also can be affected is the school, so the education, because some point we don't have enough medical facilities for isolation. So you find some countries, they're using schools as isolation sections or places. That means then the schools will be closed, and that is affecting the education side. That's pretty much in a nutshell. I'll talk of I'll look into the social aspect. As a point of the economic impact is the healthcare cost. So you do realize we don't have a specific treatment. So you are treating this patient in respect as they showcase the symptoms. So there is a little burden into the healthcare cost, because you remember, again, we still have other diseases that are still ongoing. The other thing, you're looking at the workforce and the workforce productivity, because again, you look at the training. How many people are trained to respond to the infectious diseases, more so like in the case of Mpox? Do they have the right PPEs on how to address this? If the patient cannot come to the hospital, do they have the capability to go and evacuate them from homes and bring them to the medical facilities? Another thing is, we have realized, we learned even with the COVID, is the tourism and trade. Because right now there is a lot of screening, even the border posts. So any entry, there is a limited, there's an incident that you do not have to do unnecessary travel, unless it is absolute. So that also affects now trade, and again, some countries benefit more with the tourism. And finally, you're looking at the case of the supply chain as well. So if you close the airline, definitely we're not going to be able to be moving the drugs, and especially the case of the vaccines. Then perhaps the final on a mitigation measure.
Yes, Michael, on that, let me just interrupt you. Right, on the vaccines, countries like Japan, as an example, and Germany and the US, as well as Spain, all sending vaccines to Africa, or promising to send vaccines. How can international cooperation and support be improved to better address and prevent future Mpox outbreaks, and especially in resource-limited settings?
In international collaboration, I'm looking at the sharing of resources. Perhaps the research, one of the key things you're looking at, the research and development. We may not have enough, or to cater as a resource part or the expert in research and development. Now we could have that as an exchange programs. The other thing is the data sharing and the surveillance of those diseases, which means we ought to be sharing international organization where we can share with the African Congo, these diseases, and then also then be able to track it. The other thing you're looking at is coming up with the policies and advocacy. And this is just to help globally, because this is not just an African problem, it is a global problem. And more so, again, to aid on the same, we are finding the case of finance and the logistics. So you're finding we ought, because the settings, we find that we don't have proper funding on imagining diseases like this. So then international organization can come on board. Then we have a funding. So in case that these images of the diseases that come about, is just run in there and come out, and we start executing, so that we are able to reach more. We are more of preventative than more of reactive, because that's the biggest problem that we are finding.
Absolutely.
Yeah.
Right. Michael, thank you very much for being with us on Firstpost Africa. Your time is appreciated.
Thank you. Thank you very much for having me.
Climate change is on our doorstep. It's time for a revolution to take root. And it starts with 1.4 billion Indians. It starts with one tree for humanity, one tree for Mother Earth, one tree for our future. Project One Tree, a News 18 network initiative.
On the today, the T20 World Cup Bangladesh will
loss to the West Indies. What can we expect from this?
Hello, I'm Alyson with Grange, coming to you from Durban, South Africa. Today we have a special show.
We start with a report on India's shifting nuclear posture. The first time since India officially became a nuclear power.
Hello and welcome to Firstpost America. I'm Eric Ham, coming to you live from the nation's capital in Washington, D.C.